but also diabetes. We're just going to start a little bit on the diabetes. And we all know that with diabetes, it's too much sugar and too much carbohydrate. And the body can handle it, the amount. Now, there's two kinds of diabetes. One is older, person just is, their own body makes a lot of insulin, but they become resistant to it, and then there's too much intake. And then younger diabetics have a viral problem or an autoimmune problem with the pancreas. They don't get, the insulin isn't made. And so diet is very important in that area for sure, and then there's medication. So for diabetics, for instance, what would you recommend, or what do you counsel the people that you talk with them have diabetes?
Well, I think that's a really good question and a good point. And again, the way I kind of address that again is that there's the two parts. There's the type 1 diabetes, which is something that you're born with where insulin isn't working properly. And then there's the type 2 diabetes, which is basically a choice and a decision based on the foods you're putting in your body that have gotten you to that point. What I do with people is I say, get back to foods the way that nature had intended. There's two places that we have problems. Mainstream diabetes nutrition will say, keep everything low glycemic, which I have a little bit of a problem with. What I think is a much better call is to keep your carbohydrates incredibly limited. And not only keep them limited, keep things low glycemic by adding in good, healthy dietary fats. So I'll give you an example. If you're eating things, the key point behind all of this though is actually fiber. So what happens is when you put sugar in your system, it all turns into what's called muscle glycogen, which is basically sugar in the muscles. So the sugar is going to enter your bloodstream, and it's got to go one of two places. You may utilize some of that through exercise, but it's going to go one of two places. One is your muscle cell, which is finite in size. And the best equation I can give you as something to relate to is look at that muscle cell sort of as an exclusive Hollywood VIP nightclub. Small in size, big line of people waiting to get in. Most people aren't going to get in, right? High, it's finite size, tiny little location. That's what happens to the original, muscle glycogen. So it'll fill up that muscle cell. The rest of it's going to move through your bloodstream. And basically what's going to happen is it can only go one of two places. Either A, it can be used as an energy source, or B, it's going to go stored in your fat cells. And then the best relationship I can give you with the fat cells is they are infinite in size, which is how somebody can be 600-700 pounds. So kind of look at it as the U.S.-Mexican border. Everybody just come on in, you're all welcome. That's pretty much the way that those fat cells work, is that they just get bigger and bigger and bigger. And once you activate more fat cells, the bigger they get. So as a diabetic, one of the best things you can do is keep away from carbohydrates that are not vegetables and fruits. The problem is what's being marketed to us as carbohydrates are grain products. So if you're having a good amount of vegetables and a good amount of fruit, you should be pretty good to go. The fruit content is much smaller than the vegetable content. That's probably the most important thing to realize. And it's almost impossible in nature to overeat vegetables because of what's called fiber. Fiber, most people think of as just something that makes us regular, but what happens is fiber will keep you from overindulging.
Because it fills you up.
Because it fills you up. So I'll give you an example. Just getting back to nature, how come zebras can sit there and mow down grass all day long and they don't ever get fat? Because the fiber is their safety mechanism to keep you from overeating. It's the same thing that happens with humans. So what you're going to want to do...
They also run away from lions.
Exactly. They're running away from lions. So they are active. Yeah, I definitely wouldn't negate the active factor. It's going to be really important. So what will happen is the things that are really high in fiber are not what's being marketed to us as really high in fiber. So I'm a huge advocate of a lot of those green leafy vegetables. So if you're looking at something like a cup of broccoli, what happens when you're chewing broccoli? It's like a baby tree. It's incredibly fibrous. So there are 25 calories in a cup of broccoli. And if I were to say, I'm going to give you $1,000 to eat 6 of those, it's going to be darn near impossible. So the glycemic load is really low. And not only that, those six cups of broccoli are only 150 calories. So you won't have the weight issues. And you also won't have anything with the insulin spike issues. So what you do is you mix up a salad with a lot of these very fibrous vegetables, and maybe add in a little bit of fruit. And the whole understanding of why I know you need a lot more vegetables and fruit, diabetic or not diabetic, is because how do you get them in nature? Vegetables grow up, fruit comes down. It's a lot harder to be a gatherer to gather fruit than it is to gather vegetables in a natural setting. So really what I consult, I guess the long-winded answer to that is what I consult people is if you eat according to the way nature intended, it's very hard to have huge insulin spikes, because those grains that you're eating, even though they're lower glycemic, when they enter your blood system, they all turn into muscle glycogen into sugar anyway. So just like doctor said, keeping your carbohydrates low, having good quality protein, good quality fat, lots of vegetables, nuts and seeds and things like that, you're going to be able to manage those, the diabetic issues.